All right, sorry about that. So we'll just have 2 lectures, hopefully, for the neuroanatomy, and I'll start back up with my conversation about the hippocampus. So last time we left off, we were talking about the limbic system and talking about the structure and the function. First, the structure is clearly following a kind of spiral characteristic where it starts closer to the midline and then whips around here. And we can see up here is the amygdala. So the hippocampus plays a real important role in memory formation, access memories, and the amygdala plays an important role in emotion. Now, I don't know, maybe you've seen the movie Memento, but in that, the lead character has a problem forming new memories, and this closely follows or is a dramatization of a case that is famous in psychology, case of HM. HM had bilateral damage to his hippocampus in an attempt to try to alleviate his epilepsy. He had very severe epilepsy, and so one of the neurosurgeons went in and removed his hippocampus bilaterally. Largely, there wasn't much in the way of change of his personality or other cognitive features, except for he was not able to form any new memories. So he had this permanent kind of inability to form new memories. So his long-term memory was no longer able to be updated with new information. And if you get a chance, I think Memento is a fun movie. It does a good job of kind of portraying what that would be like in a cinematic kind of feature of struggling to update that, and that would be damage to his hippocampus there. So our next structure we'll talk about is the basal ganglia. The basal ganglia plays a very important role in movement coordination, movement force, movement function. Now, again, returning back to the structure of the cortex is following or as being related to string cheese. As we continue to pick away at the cortex and seeing that string cheese pull off, you suddenly come to a structure that has a very different texture. And that outer portion is called the putamen. And that's that blue structure up here. This is the putamen. I often would argue that that is more like an olive, how an olive has a kind of a meaty kind of structure to it, or a more stronger a structure that's different from string cheese. And you can see that coming off of the putamen are these little fingers. So if we were to take and snip each one of those little fingers, so here, 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 coming off of that, then the putamen would fall away, and we'd have inside of it the globus pallidus. The globus pallidus is a structure that also is part of the basal ganglia and important for memory. Now, if we were to scoop that globus pallidus out and remove the remaining fibers, we get into the caudate nucleus. And that's this whip-like structure that looks very similar to the organization we saw in the hippocampus, where it has a spiral characteristic. And again, all 3 of these structures play an important role in movement coordination, or taking and starting and stopping movement. And that's the basal ganglia. I often think of the cortex, to give you an idea, a better illustration of this, if you can't get the 3D brain app, is imagine that you're making cookie dough, all right, or any kind of dough, pizza dough, and you were to put a little bit of dye in it while you're rolling it over. And if you were to take a cross section, you would see some of the dye as this area here in this coronal section. But if you were to then take another section, you would see it have this spiral characteristic going through the brain. And that's really what the hippocampus follows, and the basal ganglia has this kind of spiral characteristic going through the cortex. It's almost as though you can think of the cortex as the dough and the hippocampus and the basal ganglia as dye, which you put in and you folded it over. And that gives you an idea, a representation of this neuroanatomy. Now, we've considered the three major structures in the telencephalon. We now move into the diencephalon, and we'll see that there are two really important structures here. The thalamus, which is a major relay center. By that, I mean that anything from the body trying to get into the brain has to stop and synapse here in the thalamus before being allowed to go into some of that primary cortical tissue. So any information going to those primary cortical tissue areas will be leaving the thalamus and then going into those areas. Anything coming from the cortex trying to leave has to also go through the thalamus. So you can kind of think of this thalamus as a relay center or a train station where you get transferred from one part of the track to another part of the track. It's a very important structure in relaying information from those lower level structures to higher level structures. And it has an interesting kind of relationship in that certain areas that are mapped out in the cortex show that same kind of mapping in the thalamus. So if we were to stimulate certain parts of the thalamus, you could trigger movements, or we could detect sensation on your body depending on where we're stimulating that. The next structure within the diencephalon is the hypothalamus. And it's a large collection of nuclei that's involved in a variety of regulatory kinds of functions. Classic neuroanatomists or anatomists often make a joke that the hypothalamus is involved in the 4 F's: feeding, fighting, fleeing, and mating. I thought I'd wait a little bit to see if you caught that. Mating behavior. And what we see is that each one of these structures within here plays a role in that. And when we get into our motivation and emotion section, we're going to see that there are structures here, there are groups of neurons, nuclei, that are involved in feeling satiated or full after eating a meal. And if you have damage to one of that structure, what's going to happen is you're not going to be able to feel full, and you'll continually eat. So other structures here, again, are important for regulating thirst, regulating hunger, involved in mating, all these, and preparing your body for stressful situations. So this is a really important, essential part of the central nervous system to maintain normal function and also rise to the challenge of certain stressors in the environment. Beyond the hypothalamus, now we're going to move into the mesencephalon, and we have two structures here in the tectum. Tectum, again, means roof, so you can kind of think of this as being the dorsal portion of the section of the neural tube. And this picture here is a little bit strange, and I want to get you oriented to it. First of all, this is if we were holding the brain, and the rostral portion was faced away from us, or the frontal cortex was away from us, and we were then staring back at the occipital lobe. And then we remove the cortex entirely, and then we're just left with the thalamus. That's what we see here is the thalamus. And right here is our friend the pineal body. Remember who speculated the role of the pineal body in the relationship between brain and behavior? Take a moment to look through your notes. Who was that? It was Descartes. That's right. Descartes speculated about the pineal body and his theory of the relationship between brain and behavior, or dualism, right there on the midline. Now, below that, we have two hills, or colliculi, that are important for visual processing, the superior colliculus, or auditory processing, the inferior colliculus. So those two structures are really important in relaying information from auditory systems to the central nervous system or visual systems. So beyond that, we have, and now this plane that's going through here can be taken to cut through the superior colliculus, and in going through that, if we were to turn it around, now this is the ventral portion facing us. We'll have two structures that are really important for the tegmentum, and one is the periaqueductal gray matter, or PAG. So the PAG is this gray structure around the cerebral aqueduct, and it's essential for species-typical behavior related to suppressing pain. So, for example, if two rats were getting ready to fight and one was biting the other, there would be this momentary suppression of pain that would only be able to detect the pain after that conflict has been resolved. And that's the periaqueductal gray matter that's really involved in suppressing pain during those species-typical kinds of behaviors, like fighting or mating. There's actually endogenous opioid receptors that are our body's ability to momentarily suppress pain. We're going to talk more about those when we discuss certain types of neurotransmitters, and we'll come back and refer to that section. In addition to the periaqueductal gray matter that's involved in those species-typical behaviors and suppressing pain, we have the substantia nigra, which is located here, and is very important because it sends dopaminergic projections up into the basal ganglia. Damage or destruction or neurodegeneration of neurons in the substantia nigra here results in Parkinson's disease. I don't know if you're familiar with that or not, but Parkinson's disease is involved in motor systems, and it usually starts unilaterally, one side of the body where there's a tremor at rest, and as it progresses, as it can progress, it'll go to both sides, and eventually the person will not be able to start or initiate voluntary movement. Oftentimes, once they get the movement started, it's hard to stop. There's a very good movie talking about Parkinson's disease. It was based on a story written by Oliver Sacks called Awakenings, and it stars, the movie was adapted from the book, and it stars Robert De Niro and Robin Williams. And so if you get a chance to watch that, it's amazing. He does a great job of portraying the motor deficits that you see with disruption or damage here to the substantia nigra, and some of the attempts to try to develop treatments for Parkinson's disease. So those are both found in the tegmentum that are part of the mesencephalon. Next, we have the metencephalon. The metencephalon contains the cerebellum and the pons. The cerebellum, of course, is this very wrinkly structure that we see here. It has a lot of tight kinds of sulci and gyri located there, and it plays a very important role in balance, motor feedback. Often when people talk about muscle memory in terms of taking many shots at a basketball hoop or rolling cigarettes or other types of repetitive behavior that it takes a while to get good at, to really perfect that, to become a professional, like basketball player. You have to take over 1 million shots at a hoop. That motor memory, that muscle memory, will be part of it stored in the cerebellum, in addition to that being able to maintain balance. Now, obviously, we're going to have to connect the cerebellum up to the cortex, because that's where a lot of visual motor processing is going on, and the pons plays an important role. So here we've disconnected the cerebellum from the pons, and we can see where it was connected there. If we turn this around, here's the pons connecting the cerebellum. Here's the front of the pons connecting the cerebellum, then up into the cortex. Within the myelencephalon, we have now moving from the metencephalon into the myelencephalon. The one structure we'll focus on is the medulla oblongata, which contains the reticular portions of it contain the reticular formation. So the medulla oblongata plays a really important role in regulating respiration, so breathing, and heart rate. So those very basic functions. Also, it plays an important role in regulating arousal. So at the beginning of the day, you wake up, you're kind of ready for the day, you're alert. Maybe you're alert by 10 o'clock or 9 o'clock in the morning. And then as the day wears on, that alertness changes. And then by the time that 7 o'clock or so rolls around, you're starting to get a little bit less alert. You're getting a little bit more tired. That's related or governed by the activity of the reticular formation in the medulla oblongata that contains part of that. So both breathing rate, respiration rate, and general level of arousal depends on this medulla oblongata and the reticular formation. Now, within our next segment after the myelencephalon is the spinal cord. And the spinal cord runs a great length in our body. As we can see here, we have 3 divisions: cervical, thoracic, and lumbar, that we'll talk about. There are other sacral and coccygeal, and of course the caudal equina segments. I wouldn't really get too wrapped up in the number and divisions. There's differences depending on what textbook you take. What's important to recognize is that as you move down the spinal cord, we see that we're processing sensory and motor information from one strip or one ribbon of skin or area of the body. That area that specific spinal nerve that's processing coming from is referred to as a duratome. A duratome here is, for example, is processing information from L or S1 here, or this one is processing information from T5, thoracic 5. That is processing information there. And we can see this very interesting kind of relationship, that as we move down, we're moving down on those duratomes. So the spinal cord, the lower we go down, the lower that ribbon of skin that we're processing sensory motor information. This is very diagnostically important. So what we can do, if somebody has a spinal cord injury, we'd be able to touch a duratome and say, can you feel this? And that would first give us a first attempt to localize where that damage to the spinal cord is, based on what duratome is still effectively getting to the spinal cord, getting to the upper level areas that can report, oh, I can detect that, or I can't detect that. So those duratomes are very important diagnostically for determining the level of damage to the spinal cord. Now, if we go into the spinal cord, we see a really interesting organization. This is called Bell's Law or Bell-Manag's Law. That information comes into the dorsal portion of the spinal cord is all sensory information. So sensory information about touch, about proprioception, that kind of movement, joint sense, all comes in the dorsal portion of the spinal cord. And then it will either come up and ascend up into the spinal cord, or it'll come in synapse on motor neurons that are located on the spinal cord, and they always then leave the spinal cord through the ventral portion. So Bell's law states that sensory information comes in the dorsal portion of the spinal cord, whereas motor information leaving exits out through the ventral portion of the spinal cord. So dorsal, sensory, ventral, motor information coming out. And so this can be diagnostically relevant too, depending on where the damage is. Can you still detect touch, but you can't coordinate movement? Those kinds of things are part of the spinal cord organization that a doctor can use to make inferences about where the damage might be occurring. And remember that both of these, sensory and motor, are for a certain area of the body or a duratome. This kind of duratome is exiting and entering a certain level of the spinal cord. Now, what we're going to talk about next is how do we get blood into the central nervous system. And it's really important because it's organized around some of those functional systems we talked about within the lobes. First you have the heart, and the aorta comes off the heart. A branch off the heart, off the aorta, is the carotid artery, and that will ascend up into the central nervous system. We also have a vertebral artery coming up off and will ascend into the central nervous system, and they converge on what's referred to as the circle of Willis. It's a connection of communicating arteries that if there's a blockage in one place, the blood can be rerouted around the circle of Willis. So it's one of those nice features that if there's a blockage, this allows the blood to route itself around and still get to those target areas. Because if you block one of these arteries further beyond the circle of Willis, the brain won't be receiving the nutrients it needs, removing the waste, and will still start to have death, neural death. As the result of that, neurons will start to die. So let's look at beyond the circle of Willis. We have three different types of arteries. Our first is the anterior cerebral artery. The anterior cerebral artery supplies this area in blue here. So we see that it's this medial portion of the frontal lobe. So from this lateral view, you can see where that's supplied. From the sagittal view, you can see the area that's supplied, the medial portion of the frontal lobe. And from this ventral view, we can see we're supplying that medial portion. Now, here's a quick little question. What functions would you imagine would be lost if you had blocked the anterior cerebral artery? Before you answer that, I want to indicate that we have both a left anterior cerebral artery and a right anterior cerebral artery. So if we have a blockage in the left, that would spare the right. If we have a blockage in the right, that would spare the left. So just to ask the question again, what happens if we would have a blockage in one of our anterior cerebral arteries that's hitting this more lateral portion, or some more medial portion of the frontal lobe? What things might you think would be lost? One thing you might say is emotion, and you would be correct. Another thing you might say is attention, and you would be correct. Maybe movement, and you would be correct. But there was another function we talked about, and that was language. There's some language function in the frontal cortex, and it would actually be spared. So this gray, this brown or mustard color yellow area here is supplied by a different artery, and we'll talk about that in a little bit. But language function should be left largely intact. So the anterior cerebral artery supplies this medial portion of the frontal lobe, and if it was blocked, you might see problems with emotion, attention, movement. Those kinds of functions will be lost, but language function would most likely be spared. Now, the posterior cerebral artery supplies these areas that are red in color. And so we see it's the parietal cortex, occipital cortex, and the ventral portion of the temporal lobe. So if we had blockage, in, just like with the anterior cerebral cortex, cerebral artery, we have one for each hemisphere. We also have one posterior cerebral artery for each hemisphere. So if we have a blockage in one of those, what might we expect to be lost? I'll give you a little bit of time to maybe review your notes and look through that. So if you said vision, you'd be right. There would be problems with visual processing. If you said somatosensation, because this does go up to the parietal lobe and that somatosensory cortex, you'd be correct. If you said maybe a loss of the ability to detect a certain side of space or constructing space, you'd be correct. Now, if you said, oh, temporal cortex, didn't you say something about auditory processing and language? You would be incorrect, because just on this ventral portion, that's that higher level visual processing, and we'd essentially be sparing that ability to detect language, but impairing that ability to recognize faces or lines or certain colors. So that would be lost. So the posterior cerebral artery is supplying this area of the parietal cortex, occipital cortex, and this ventral portion of the temporal cortex. Now, our last artery we will talk about is the middle cerebral artery. And this is a picture that displays the middle cerebral artery branching up over across the cortex. And what we can see from this coronal section here is that there is a superior branch and an inferior branch. And you see it takes kind of a tortuous, a very complex path out of the brain to get out to the cortex. And one of the things is that this is an artery that is sensitive to strokes. And it's also supplying this area of the brain that's outlined here in this mustard yellow color. Here is this area is supplied by the superior division. This area is supplied by the inferior division. So if you had a blockage here in the superior, so you had a clot or something that was here, you would lose neurons in this area, and that's part of the frontal cortex, and you would lose the ability to produce speech. You would still be able to understand speech, but you wouldn't be able to produce speech. Whereas if you had a blockage here, this inferior division of the middle cerebral artery, you would lose the ability to comprehend speech, but you'd still be able to produce speech. Those are two different speech disorders that you see that depend on what part of that artery is being supplied to that area. Now, if you have blockage back here that supplies both the superior and inferior, you would lose the ability to either produce speech and comprehend speech. So those would be two problems that you would see. So the superior division produces impairments in producing speech. Inferior division produces impairments in comprehending speech. A blockage back here in the middle cerebral artery will result in a loss of both of them. So very important to keep that in mind when reviewing this material. The role of the middle cerebral artery in speech production and comprehension. Now, we turn to how is the central nervous system protected from the environment. So as you're getting out of the car today, you maybe hit your head. You don't really want to scrape out part of your cortex with hitting your head on the roof. So we have of the car, or you open up a cabinet and you hit your head. You don't want to scoop out part of your parietal lobe or part of your frontal lobe. We want to protect it. And the skull does a good job in those minor bumps and encounters with the environment and protecting it so it doesn't get hurt. And what we see here is a picture of the brain within the skull. We can see that there are certain areas of where the brain rubs up against the skull, and while it protects us under normal conditions, the skull also has some limitations. It's kind of like anything. There's some costs and benefits. The benefits is mild scrapes and interactions. You're going to protect the brain. But if you start to have more severe head trauma, you get hit over the head with a baseball bat, or you fly through the windshield of a car, what's going to happen is the skull is still a box, and there are very few exits. And what happens if you get bitten by a mosquito? Well, that area starts to swell. That same kind of swelling happens if your head, if your skull hits a windshield or gets hit by a baseball bat or a fist. The brain inside is going to want to start to swell. And as you can see from this picture, there's pretty much only one exit here. There are other exits, but one major exit is right here at the base of the skull. And at that location, the one structure that's willing to be pushed out, herniated out of that hole, is the medulla oblongata. Now, do you remember what the medulla oblongata was important for? Look through your notes. That's right. Respiration and heart rate and general arousal. So you can imagine if we take and start pushing the medulla oblongata, stretching it out of that hole at the base of the skull, we're going to start tearing those neurons and disrupting the function of that area, and those cells will die, and your ability to regulate heart rate and breathing is going to be lost. So very quickly, it's very important to try to reduce the pressure in the brain. That's one aspect. But another aspect of the skull that's a cost is that you see the inside is not a very smooth surface, but there's a lot of little ridges and sharp areas. And so if you're in an accident and you come immediately to the stop, it's almost like if you had a glass of ice water and you're moving it and all of a sudden you stop the movement, the ice wants to push up against the edge of the side of the glass. The same thing happens with your brain, is it wants to push up against the edge. And what you'll see is these areas highlighted in green, red, and blue will start to get bruising. Just like how you have a bruise on your leg, these will bruise. And that's also problematic for those areas. We see we're going to get some of the frontal cortex here involved in that, maybe translating or resulting in problems with attention. We'll have some of the temporal cortex, maybe some visual problems here. And the cerebellum, maybe some motor problems. So these things are all important to keep in mind. Why to wear a helmet if you are riding a bike, or wear a seatbelt if you're in a car, to help prevent some of these issues. In addition to the skull, so do we just place the neural tissue right next to the bone? We actually have a couple layers of protection that try to cushion the brain against the harsh skull, and those are the meninges. And we have 3 layers of protection. The hard outer layer that I would say is kind of like some of the plastic you might use to cover windows during winter. The dura mater is a nice tough outer surface. It would be hard to cut with scissors. You know, you have to get a really sharp pair of scissors to cut through the dura mater, but that's the outermost layer that is going to be thick connective tissue that is right next to the skull. Beyond that, below that, is the arachnoid mater, or arachnoid layer, and that is filled with cerebrospinal fluid, and the blood vessels are very close to that. So it's this fluid kind of filled area here. Below that, and it's filled with cerebrospinal fluid that's constantly in flux, moving. Below that is the pia mater, which is directly associated with the surface of the cortex. So you have the outermost layers, the dura mater, very tough kind of connective tissue. Below that is a fluid-filled cavity with a lot of small connective tissue. The arachnoid, you might have think of it as being kind of like a spider web. And that's why they kind of refer to this as the arachnoid mater. And then below that is the pia mater, or the layer of meninges that are connected to the surface of the cortex. Now, the meninges cover the entire central nervous system. That's brain and spinal cord. And one of the things that can happen is sometimes you can get an infection of the meninges or have meningitis. What's interesting about the meninges is they go out the full length of the optic nerve up into the eye, and they stop at that point where your eye, the nerves leave and enter the eye, or the optic disc. And because the central nervous system, the meninges can become infected, that increases pressure, a doctor can look in your eye if you report feeling sluggish and you have a fever and there's a lot of indication, maybe cognitive slowing, you may have meningitis. The doctor can look in your eye and see whether that optic disc is puckering out. And so a puckering optic disc would indicate to the doctor that you may have meningitis. That may be the problem. So it's a simple kind of inspection that you can kind of see whether or not that's a significant infection by looking into your eye. In addition to the meninges and the skull, we also have another structure, the set of structures that make up the ventricular system. Now, originally, historically, people argued that the meninges were important for housing animal spirits. That is not the case anymore. People still speculate about the function of them. They're filled with cerebrospinal fluid and may be part of a communication system. People also argue the role for these hollow cavities filled with cerebrospinal fluid and being able to translate force and be able to sustain weight. So another feature of why the central nervous system was able to get as large as it is that making it hollow allows it to suspend itself and not weigh itself down. What we see here, and we get to return to this, remember in the hippocampus we had that spiral characteristic, in the basal ganglia we had that spiral characteristic. Now again in the ventricular system we get to see that spiral characteristic returning back. Here we see the lateral ventricles kind of having that spiral characteristic where they start close to the midline and spiral around. Here we can see from this perspective the lateral ventricles here connected to the third ventricle that's very, very thin. Here you can see its structure from the side, but if we take this dorsal view, that third ventricle is so thin, and that third ventricle then is connected to the fourth ventricle via the cerebral aqueduct. So here's the third ventricle here, and then there's the cerebral aqueduct, and then there's the fourth ventricle. Again, if you can download that 3D brain app, this will allow you to rotate and see how these ventricles are arranged relative to one another. So the lateral ventricles, we have two of them. They have a spiral characteristic like we saw in the basal ganglia and the hippocampus. They are connected to the third ventricle, which is very thin and on the midline, and it's connected to the fourth ventricle via the cerebral aqueduct. And so we can see that there in this picture. Now, one last thing we'll talk about in terms of the neuroanatomy. Of course, this is just meant to be a general introduction. As we go through these different sections, we're going to refine our discussion of the neuroanatomy. We can see there are decussations. These are points where fibers cross the midline. And here what we see is that information from the right visual field will cross over and get to one hemisphere. So anything in the right visual field eventually makes it over to the left occipital cortex. Anything in the left visual field will cross over and make it into the right hemisphere. So a decussation is any time that those fibers cross the midline. So you can have sensory information crossing the midline, or you can have motor information crossing the midline. And what we see is that sensory information can come in. So we have the right hand, we're detecting touch, that's going to have to cross the midline to get over to the left hemisphere. Controlling the right hand comes from the left hemisphere. So if we were to stimulate a little part of the right frontal cortex, that would cause the left frontal cortex, that would cause your right hand to contract or move or make a twitch. This is not unique to humans. This is actually observed across other animals. This picture is illustrating the exact same sensory, visual, somatosensory, and motor control in rats. And we can see that information from the right visual field makes it over into the left hemisphere. Somatosensory information, touch information from the right forelimb goes over to the left hemisphere. And control of movement of that right limb depends on the left hemisphere. So this crossing over is observed in both the sensory systems and the motor systems. And anytime there's a fiber crossing the midline, we refer to that as a decussation. Well, we're done with our functional neuroanatomy. Again, we're going to revisit this throughout the chapters and getting used to more information layered onto this. So this is just meant as an introduction. I would encourage you to go through this several times prior to trying to attempt the lecture quiz or the practice exams. Your book does a wonderful job of describing these structures as well, so use those as a guide. And again, you should be taking notes from these lectures and using them to organize your your thinking and studying about this material. And that's it for our chapter 2, talking about the neuroanatomy of the central nervous system. And our next chapter will talk about the functional units of the central nervous system. We'll go from this gross level down to a more smaller level, microscopic level, and talk about neurons and glial cells. Have a good day.